When you take a look at the epidemiology of chronic disease is really the biggest disease of our time, and it has to be eradicated in order for us to make healthcare affordable. But here's the caveat to that, is that if you live in a food desert, in an underserved community, and you have no nutritional resources, it's not really your fault. And if you take a look at wealthy people, they all have concierge health. They go to their doctor and spend an hour with their doctor, right? Why can't we provide those resources to underserved communities?
Areas in which deprivation and poverty have been endemic for decades, for generations, are those which classically follow the inverse care law. Those who most need it get least of what they require. In this day and age, it's simply not good enough to abandon a sector of our population, whether that's by culture or by income or by language. We have to find a way to provide equivalent or better healthcare to those who need it most.
As tempting as it may seem to ask people to adopt more responsibility for their health, we need to meet them where they are. We need to see where they are in terms of their socioeconomic status. So for me, to ask someone to eat healthily or to exercise more is not going to be a very effective strategy for someone who has 2 jobs, is getting very little sleep, and has very little money. So we need to understand the structural factors around people, particularly as it relates to their socioeconomic status, in order to achieve the outcomes that we're looking to achieve.
So I can blame the doctor for this or for that, or the pharmaceutical industry for doing too much medication, an opioid crisis. But really, when I think about myself and my life, it's me who determines my health care, not the physician.
We are not the healthiest of nations, and we need to take a page out of many other countries' playbooks that are doing very well because they have a healthier society. What most people don't understand is they think that they're given the genes that they were born with, and those genes are going to express into some potential disease process. But we have a lot more control than we give ourselves credit for. How we choose to eat, how we choose to exercise, what size we want our waistline to be, how we sleep at night, how we react to stress. We all have stress in our lives, but how we choose to react to that stress can definitely change how our genes are expressed. That is the piece of healthcare that I was never taught about until I sought it out myself for additional education. That is the piece of healthcare that is lacking in the United States. And there are some countries around the world a little bit more progressive, but we missed that boat.
Sometimes when you go in, you have anxiety. Sometimes you don't even want to go because you start thinking like, man, maybe I can't even afford it.
When I got off of my parents' healthcare plan is when I realized that it's not going to be that easy to, have that same level of care that I used to. And then when I couldn't book appointments because they said, oh, we don't take your insurance, or, oh, you have to get a referral first. And, oh, to get a referral, you need to make an appointment with us. The next appointment we have is in 6 months. So it's just like, I can't get anything.
My premium is over $200 a month, and that's the cheapest I could get. And my deductible is $8,500. So I'm paying $250. It's more than my car insurance. It's more than my utilities a month for healthcare that I don't even get to benefit from unless I reach $8,500.